Hi guys, good morning. Happy Sunday if you're in the United States. And thanks for joining me on live this morning and Sunday at 10 a.m. Eastern Standard Time. Thanks to those of you who did tweet me with the hashtag live with Dr. Malik. I will start by answering those questions. Hope you guys are doing so great today. Can you all hear me okay? I hope so. So basically, the first question I got was how to deal with urgency for urination. And urgency for urination occurs for a lot of different reasons. But basically, what happens is your bladder is like a balloon that holds urine. And when it spasms, it creates this urge or sudden desire to go to the bathroom that you can't really hold off on. And so when that happens, you have to rush, or sometimes people will even have accidents. But why does this happen? Well, there's two major reasons. It can either be a problem with the bladder itself, most often because of overactive bladder or having a neurologic condition that can affect how the bladder functions, or it could be an outlet problem, meaning that there can be something blocking the bladder, which makes it have these spasms. And that can be because of a large prostate, because of some narrowing of the urethra, like a stricture. And so depending on what the problem is how you can fix the issue. But if you're at home and you can't get to a doctor, the things to try are to avoid certain bladder irritants. I have a whole video about bladder irritants, but basically those are spicy foods, artificial sweeteners, alcohol, caffeine, and kind of citrusy fruit juices. I would say that, not everyone is sensitive to those things. So if you find that you are having urgency, maybe cut one thing out at a time and see if that helps your symptoms at all. The other thing is make sure you're not constipated, because that can worsen those symptoms. And just watch how much you're drinking. You don't want to drink a ton because you're going to be going to the bathroom a lot. You don't want to drink too little because that will make your urine more concentrated and more cause some irritation of the bladder lining. And if you're smoking, quitting smoking can help quite a bit, and losing weight can help. So if you're overweight, losing 8% of your body weight can actually help reduce urinary symptoms. Another question I got on Twitter was about delayed ejaculation. So I'm going to actually have a video about this coming up with a colleague of mine who does a lot of medical management for delayed ejaculation. If you're having normal ejaculation with your partner, with yourself, like with masturbation, but you can't have it with your partner, then it can be a number of different things. It can be that you're used to a certain type of stimulation, a certain type of pressure that you're using when you masturbate, or a certain kind of activity. So you kind of need to take a break and let your body kind of recalibrate with so that you can get the same sort of enjoyment from your partner. And you can kind of experiment with your partner in different ways and see if something helps you ejaculate sooner rather than later. And then there are some medical treatments available for it as well. And like I said, I'm going to have a video on this coming up. All right. Thank you guys again so much for joining me. And so let's see here. Does obesity have any impact on erectile dysfunction? So absolutely, obesity does. And guys, I see that you've asked that question 4 times. I know you want to be seen. Please just ask it once. I will try to scroll through the questions and get everyone's questions as best as I can, but it's not fair to other people if you keep asking the same question over and over again. So obesity can affect, so if you think about what affects erectile function, it is actually anything that makes your heart work less well. So anything that's not good for your heart, like eating poorly, having excess fat, having smoking, or being like sedentary and not doing good activities, those things will affect blood flow to the penis, as well as the blood flow to your heart and everywhere else in your body. So living a good, healthy lifestyle, which is eating, more fruits and vegetables, making sure you're physically active, not sitting all day, all sorts of things, can help you get your erections more strong. And also, I do have super chat available. So if you want to ask a question and get your chat seen more readily, you can certainly use that. Someone asked about scrotal calcinosis. So scrotal calcinosis is when you have kind of these little, they feel like tiny little cysts on your scrotum, and they don't look very sightly, but they are not dangerous at all. They're not going to hurt you in any way. They're not cancerous. They're nothing that's bad for you. And so if they are bothering you as far as appearance, the only way to get rid of them is through surgery. Okay. questions here. Can premature ejaculation be cured? So I had a video that I made where I reacted to Sex and the City, an episode of premature ejaculation. I go through the treatments there, and I'll probably make another video on this at some point in the future, but there are no like FDA approved treatments for premature ejaculation if you're in the United States, but there are certain things that we use to help men who are experiencing premature ejaculation. And that is extremely common, guys. So if you're experiencing it, you're not alone. It's okay to be in the group that's having it. It's very, very common. It's, reported in about 20% of men, but probably even more than that. And so for that problem, there are a couple off-label treatments. So there's EMLA cream, which is basically lidocaine and prilocaine, which are numbing agents that you can put on your penis before sex. You do need to wash it off so that it doesn't kind of transmit to your partner, so they don't get any numbness. And that can help you have longer intra-ejaculatory latency time is what we call it. So have more time before you ejaculate. There's also some over-the-counter available things like delay sprays. And I can certainly link a delay spray in the description after I'm done here, so you guys can see one by Promescent that I often recommend. And then there are medications, which are actually antidepressants, but they also have been shown to increase intra-ejaculatory latency time. And so there's also Kegel exercises. So kind of doing certain exercises and breathing techniques can also help you increase ejaculation, intra-ejaculatory latency time. Okay. So risks of taking more sildenafil than prescribed. So sildenafil is a medication that is for erectile dysfunction. And what it does is it increases nitric oxide, which is like the ignition for erections. And so when you take sildenafil, there are certain doses you can take. You can start at 50 milligrams, 100 milligrams, and take it as needed, an hour before sex. You want to take it on an empty stomach. I find the most common thing I see with men is that they're not taking it on an empty stomach. So it's not going to be as effective. And also you need some stimulation for it to work. You're just not going to just develop an erection. It needs to still have the ignition for the erection to start. And so you don't want to take higher doses because it can cause your blood pressure to bottom pretty, low. And the biggest risk is you don't want to have what's called a priapism. So a priapism is an erection that lasts longer than 4 hours. And I've actually made videos about this, reaction to it to Grey's Anatomy before. It's one of my first videos that I made, and it is a, kind of scary thing to deal with, and not fun to have to go to the emergency room to manage. The reason you want to go to the emergency room is because it'll actually after 4 hours of an erection, you'll actually start losing blood flow to the area, and it can cause irreversible damage. Garth, thank you so much for contributing to the chat. Really appreciate you here. All of you, I appreciate all of you here and watching. Okay, so how many water should you drink per day? That's a great question. So, our bodies are really, if you're a normal, healthy person and not like a person who creates kidney stones or transplant or other reasons that you might need to drink more water, they say 64 ounces of water, but that doesn't include the water that you get from fruit or vegetables or what you're eating. If you're having soup or smoothies, that's also fluid. And so really you need to drink you need that much, but your body has a good thirst mechanism. Like right now, I feel thirsty, so I'm going to have a little bit of water because I feel thirsty, and my body will tell me, okay, when I'm thirsty, I should drink. And when I'm not, I can not drink. And so my body has a good homeostasis mechanism. Of course, sometimes I'm guilty of this, where I will not drink enough because I'm busy or we're not working. And so, I think that you should make sure that you're drinking enough to your thirst and you're not ignoring your body when it tells you to drink. Another question from Achim: are there any risks of using hair removing creams besides possible allergies? It's a great question. I don't believe so, but I'm not a dermatologist, so I wouldn't be the right person to ask that question. Always do a test if you're using a hair removing cream on like your hand or your arm before you use it in any private area or in a larger area, because you don't want to risk having an allergy in an area that's really uncomfortable. Samir, thank you so much for contributing to the super chat. Really appreciate you. Okay, so I see this all the time. This comes up. I don't know if this is exactly the question you're asking, school techies, but there are spots sometimes that people see on their penis called pearly penile papules. Google it, you'll see pictures of it. There's tiny, tiny little spots. And I see a lot of men asking about these. Are these dangerous? Can I get these removed? And so they are not dangerous. They are completely benign. They are not a sexually transmitted infection. There is nothing wrong with them at all. They only can be removed with surgery, and we don't recommend doing it because really they're not going to harm you in any way. As far as vitiligo, I'm not a dermatologist, couldn't answer that specific question, but no, I don't believe there's any way to treat vitiligo of the penis. Okay, I've seen this question a couple times. What are my views on no FAP? Is it good or bad? So I think that the no FAP movement is essentially abstaining from any sort of ejaculation for certain periods of time. November is like FAP month or whatever. And I think that if that's something you want to do and you find benefit from, there's certainly no harm in it, but there's no good clinical data to suggest that there's a benefit to it. Certainly, I think that a lot of people who end up participating in the FAP movement are using a lot of masturbation, a lot of pornography, and that can affect your ability to focus on other things if you're really using that a lot in your daily life. And so if that's the case, then holding back from that can bring some clarity, mindset, things like that. But again, there's no proven benefit to it. I have actually seen some people who hold off from ejaculation actually develop pelvic pain because they're getting a lot of stress and anxiety from it. And if that's the case, please don't continue and go ahead and go back to your normal routines. Apotheosis, thank you for contributing. So how does having big balls equal high fertility? Do large balls equal high fertility? No, actually, that's not necessarily true. It's about the actual quality of this sperm itself that comes from the balls. So certainly you can have big balls, and the sperm can having smaller balls or ones that are very small can be a sign of infertility or a concerning sign, and something that we'd evaluate if you were having trouble having children. But having large testicles in and of themselves is not going to be necessarily a predictor of fertility. Being fertile for the most part is a very complex array of things that contribute to it, and much more detail that I can get into in a couple minutes. Okay, so question about penile implant. So a penile implant is essentially an implant that we place for men who have refractory erectile dysfunction, meaning erectile dysfunction that is not treated with medications or other options. And there are other options for erectile dysfunction, including medication, which we talked about a little bit earlier, like sildenafil, vardenafil, and tadalafil are medications that are available for erectile dysfunction. There's also vacuum erection devices that you can use to help get erections. There are intraurethral suppositories and gels that can help you obtain erections, as well as intracavernosal injections, which are essentially injections that you give yourself in the penis that work very, very well for erectile dysfunction. And if all of those fail, or you don't want to try some of them, and a penile implant is something that you can get implanted. And I've made a couple videos about implants and talked about them. One was a guy who had a penis on his arm. It's a news story about this guy, so you can watch that video. And one is about a Grey's Anatomy. It's a two-part video where a guy, an older gentleman gets a penile implant and gets some kind of pushback from his family. And so essentially what it is, it's a surgical technique where we actually implant 2 cylinders in the penis, a pump in the scrotum, and a reservoir that goes in the lower part of the abdomen. And then when you want to have an erection, you pump it up. It is a quick procedure and typically very successful, but there are some things to know before you have a penile implant placed. One is that it's irreversible in the sense that if this fails, you can't go back to having normal erections, because to place it, we actually have to put the cylinders in through the penis. So that's one thing. And two is it does expand in length and girth, but it's not going to give you more than what you have. So you're not going to get longer or girthier than you were before. And so if that's your goal, then you're not going to get that with the implant. It's really to have you have erections that allow you to have intercourse. Okay. let's see what else. So low intensity shockwave lithotripsy, I've seen that a couple times. And thank you guys again so much for the kind words. I'm seeing a lot of highs and I look great. Sorry, my hair is all wet and I just, had to get on. I was already running late for you guys. But so shockwave lithotripsy for erectile dysfunction is currently investigational, meaning that they are still studying what's the correct type of shockwave machine that you should be using, what's the correct amount of frequency that you should be getting these treatments in, and who is it best suited for. Is it good for men who have erectile dysfunction from a vascular cause, like maybe high blood pressure or other things like that? Or is it for men who have diabetes, who have usually more of a neurologic consequence that causes their erectile dysfunction? So right now, we don't know necessarily who it's optimal for and who it's going to work best for. So I tell people, don't pay out of pocket for this right now. Wait till the investigations are over and it may be a good option for you. I will make a video on this as well later. Thank you again, Garth, for another participating with the super chat. Thanks so much. So another question, is it normal to have ED when I'm under 20? This is a great question because I see this sort of thing very often in my clinic. And so I will say there's two main causes for young men to have issues with erections. The most common one is psychogenic, or it's caused because of issues with managing your kind of mental state when you're having erections. And so it's very hard because if you have an issue with performance, which happens to everybody, okay, don't feel alarmed if it happens to you. It happens to everybody. It could be that you drank too much or whatever the reason, and you have an issue with performance. It then creates this anxiety, which is then a self-perpetuating cycle. And so you get anxiety, you have another issue with erections because of the anxiety, and then you're like worse and worse every time. And then you feel like you have ED. And so actually, you can go see a sex therapist. Sometimes I'll have some young men go try just a very, very low dose of medication to help them gain back their confidence. And then once they've got their confidence back, we can stop it. And then also the other main cause is actually high tone pelvic floor dysfunction. So some people hold anxiety in their pelvic floor. And when you hold anxiety in your pelvic floor, you may not even know it, but it can actually reduce blood flow to the penis, which can make erections more difficult. So learning how to relax that pelvic floor with a pelvic floor physical therapist, or if you don't have those sorts of things near you, you can Google pelvic floor releasing exercises and learn about that. Another question is, are fetishes okay for men? So yeah, fetishes are totally fine as long as you're safe, you're being safe, and you're respecting your partner's desires, whoever that partner may be. There's no harm in having a fetish as long as, like I said, you're safe about it. Let's see. What is retrograde ejaculation? So that's a great question. Retrograde ejaculation is what happens when you have erections that ejaculation, and then you have very little sperm or semen come out, and that's because it's going retrograde, meaning it's going into the bladder rather than coming out through the penis, through the urethra. And this can happen for a couple different reasons. Sometimes it's long-term diabetes, sometimes it's having medications like Tamsilosin or other medications for a large prostate. Sometimes it's for you've had surgery on the prostate, that can happen as well. And so it's not dangerous to you in any way, but it is something that can be quite a bother to people. Okay, so this person, Robert Duncan, is multiple sclerosis can affect erectile function very, very commonly, can also affect bladder function. So if you're suffering from multiple sclerosis, very commonly you will see symptoms such as erectile dysfunction, as well as urinary symptoms where you might feel like you're not emptying your bladder, you might have really strong urgency, gotta go. And then when you go to the bathroom, you actually can't empty. So these are very common symptoms that happen with multiple sclerosis, and the treatment is in fact the same as the treatment for anyone with erectile dysfunction. And that is working on medications, as we talked about, or intracavernosal injections, vacuum erection devices, intraurethral suppositories. So there are a number of different options available to help improve erections, but they are, there's currently no specific pathway for patients who have neurologic disease causing erectile dysfunction compared to other regular people who have erectile dysfunction for other causes. What's the best time of day to take Tamsilosin? There's really no best time of day. You just take it once a day whenever you want. Some people do notice a difference if they take it at night because they're waking up a lot at night, and that may improve that. Some people notice it's better during the day. As long as you're taking it once a day, that's really all that matters. Another good question I saw is what's better, Viagra or Cialis? And really, there's no better. It's that they're different, and some people may have benefit with one versus the other. Viagra is sildenafil. It's taken on demand before intercourse, 30 minutes to 1 hour before sex. You need to have stimulation for it to work. You need to have it on a empty stomach. With this medication, side effects are sometimes people feel like a stuffy nose or like a head cold. Sometimes people have blue-green discoloration and may have some just like if you have blue-green discoloration, you want to stop it, but otherwise other side effects are really mostly those. And with the Cialis, that you can take on demand, which is like 10 to 20 milligrams before sex. Again, you need stimulation for it to work. The side effects are similar, except for you won't have that risk of blue-green discoloration. The other side effect is kind of muscle aches. The other benefit of Cialis is you can take a low dose, 5 milligrams every single day, which can help increase, also treats erectile dysfunction, and interestingly also treats urinary symptoms. So if you have a large prostate, it actually helps relax the prostate and helps with urinary symptoms like not waking up at night, having to urinate more frequently and urgently, or straining to urinate. So it actually has the dual benefit. And I prescribe it very often because it helps with that spontaneity. Guys, there's so many questions and I really want to get to all of them. I'm so sorry. Thank you guys so much for being here and asking all these questions. It's really awesome to have you here. And thank you for all the kind words as well through all of this, and the super chat donations. Thank you guys so much. Hematospermia, which is blood in the ejaculate, is a very common diagnosis, and is very safe. So I know it's scary, super scary to see blood in your ejaculate, but most often it's a benign condition. You can certainly see a urologist if you want to have it worked up, but most often, as long as it resolves and you're otherwise feeling well, don't worry about it. Okay, so they're so fast. You guys are so fast. All right. So, okay. Does jelqing work? So there's a question here about jelqing, and jelqing is a process by which men use their finger and this like okay sign and try to pull the penis to help increase length. I would say that it's really, it can be dangerous and can cause irreversible damage if you're actually causing trauma to the vessels of the penis. And so I don't recommend it, but I do know certainly people do it and have good results with it. And you'll see all sorts of comments online, but I personally would not recommend it. Couple questions. Is it unhealthy to watch porn? It is not unhealthy if it's not interfering with your quality of life, meaning you're still interested in other things besides watching porn, and you do it, it's not interfering with your work or your life or hanging out with friends or other things that you do. Are you aware of post-SSRI sexual dysfunction? Absolutely, guys. This is a real thing. So if you're on SSRIs, which are antidepressants, they can cause decreased libido, as can another medication called finasteride, which sometimes men use for hair growth, like a low dose, or even some people use for a large prostate. Both of those medications can cause decreased libido and can cause sexual dysfunction. It is often reversible, depending on how long you've been on the medication. So if you are noticing that, please notice that. Please, take a look at that. Okay. Some of you guys are so funny. Okay, so I don't know what the question was. Apotheosis, if you can put it back in. There's just so many questions here, so it's hard for me to find all the questions. Okay, so can you take folate and niacin together to help with ED? So I don't really recommend taking supplements unless you've talked to your primary care doctor about it, made sure it's safe for you to take those supplements with other medications you're taking. They likely won't hurt you, but please do your research as far as what what the side effects are online. There are some good websites like WebMD that goes through side effects that are reputable, and make sure. There's also another one called examine.com that I found recently that's pretty good. So please make sure that they don't you can take them safely and they're not going to mess with the other medications you're on or cause problems for your other medical problems. Do I suggest circumcision for diabetes? I've seen a lot of circumcision questions here, and circumcision is removal of the foreskin. In the United States, we do it very often for children. There is data to suggest that there is lower risk of STDs. In fact, that's very strong data to suggest there's lower risk of HIV, completely eliminates the risk of penile cancer. And so a lot of people do it. It reduces the risk of having bladder infections or UTIs as for boys. And so that's common. And then for diabetes, as an adult, if you want to get a circumcision, the common reasons are phimosis, is when you have foreskin that you can't retract, that may be causing pain or discomfort, or you can't, clean properly, or if you keep getting balanitis, which is infections. Those can be reasons to get a circumcision as an adult. If otherwise your foreskin is normal and healthy, there's no reason to get one unless you personally want one, and then you need to know the risks and benefits. And I've made a video on this in the past about circumcision. Please check it out. And I'll try to put all the videos that I'm talking about in the description after I'm all done with this chat, okay? Leon, I'm sorry you said your doctor's not doing enough to help you. I apologize that you feel that way. Please find another doctor if you feel that way. For all of you, if you have issues that you feel like are not being resolved by your doctor, see another doctor. Don't suffer in silence. It is sometimes hard to find good care depending on where you're located or a number of different factors. So please, especially now with telemedicine, at least in the United States being more common, you can at least look for other doctors in your state that can help you and see you over the internet or over a virtual visit. So premature ejaculation, Pratik, I've talked about before, so you can look back, rewind back on the video and find the answer to it. I've also made a video on this. Sex in the City, Reacting to Sex in the City is a title, and I talk about a number of the cures. I'll probably make another video about it as well. Does gymming increase testosterone? So I think that means going to the gym. So testosterone does increase with high intensity interval training or resistance training, and that's been shown in studies. Certainly incorporating that in your daily exercise or weekly exercise routine can be beneficial for testosterone as a natural increase. So testicular sensitivity, thank you, BK, is a very challenging problem to manage, and there are a number of things that can cause it. It can be caused from pelvic floor dysfunction, where you have a high tone pelvic floor, and can cause impinge on the nerves that go to the testicles and cause pain. It can be because of neuropathies or problems with the nerves. There are a number of different things that can cause pain with the testicles. You do need to be evaluated, make sure you don't have an abnormal mass or anything else in the testicles. So getting a testicular ultrasound is often done to make sure there's no other underlying problems, but really getting examined, I recommend as a starting point would be try to take a 20-minute hot bath every day to kind of relax. And doing some mindfulness and meditation and trying to, relax the stress. That will help if there is a high tone pelvic floor component. But again, there may be other things that could cause it. Is it bad to have cysts on the scrotum? So usually most cysts that are on the scrotum itself are benign and not concerning. If you have a lump in the testicle, please see a urologist. It most commonly affects young men. So if you are a young man and you feel a hard lump on your testicle, don't delay, go see a urologist. Testicular cancer is extremely easily treated and very high success rates, but you don't want to delay until the testicular cancer, if that's what you have, spread somewhere. So if you feel a lump in your testicle, like on the ball itself, please go see a urologist. I've seen this question a few times. How can I fix my lateral pelvic tilt? I'm not exactly sure. I would talk to a physical therapist who'd give you that answer a little bit better. Do I recommend edible underwear? I mean, if you want to, all for you, go for it. I haven't seen Black Widow yet. I'm excited to watch. I do like Marvel quite a bit. Thanks for asking. Uh, can castrated men still have sex? Yes, you can still have sex, although you may have low libido from the lack of testosterone. So it is something to kind of consider. You may need testosterone replacement therapy if a castrated man wanted to have sex. Is a testicular ultrasound uncomfortable? So no, actually testicular ultrasound it's uncomfortable because you're like having somebody putting a probe on your testicle and putting gel on it, but it's not painful in any way, just like a weird experience, so to speak. Is there such a thing as foreskin restoration? So not to my knowledge. I don't know of any foreskin restoration. I've seen some people doing things that are marketing things like pulling on the skin and all sorts of things. But no, I don't think you can get back what you lost, unfortunately. Okay, so Deidre, thank you for, I'm sorry, I'm saying your name wrong. But thanks for asking. So if you have, this woman is specifically saying she had a urodynamics test, which is a test that is used to evaluate bladder function. And within that test, it's basically a test where you get a small catheter in the bladder, a small catheter in the rectum or in the bottom, and we fill the bladder. And through that test, we can see how big your bladder is, how sensitive your bladder is, if you're having any abnormal bladder contractions, what the pressure of your bladder is. And then when you empty your bladder, we can see if your bladder is squeezing really, really hard or there's no bladder squeeze. And we often do it for patients when they're having bladder leakage, they're having symptoms that we can't really attribute easily to one diagnosis. So if you have other comorbidities like you're diabetic and you're having urinary symptoms, or you have neurologic conditions and you have urinary symptoms, we'll do them. In your case, they said you have a PVR of 700. What that means is a post-void residual. So that's when you're done peeing, how much is left in your bladder. And in this case, 700 is quite a bit. So the average person can hold somewhere between 300 to 600 mLs in their bladder as far as the whole capacity. When you're done urinating, you should have very little left in your bladder, usually less than 50 mLs. But many people walk around with more than that, 100, 150, 200, and do okay and may not have symptoms. If you're having more than that, it can put you at risk for infections, bladder infections. It can make you have more urinary symptoms like urgency, frequency. It means that you're basically not emptying your bladder effectively, and a urodynamic study should tell you why that is. And so if it can be either because your bladder is squeezing too hard and it's not emptying because there's a blockage, or it can be because your bladder is not squeezing hard enough. If there's a blockage, you work to treat the blockage. If there's not a blockage, and it's the bladder that's not functioning well, then there's limited treatment options, but there are some depending on what's going on. Is a strong core required for the best possible sex? So, having strong abdominal muscles and muscles in general can be helpful for, a lot of different things. And I think that people who are generally more fit have stronger Kegel muscles, which may have them have stronger orgasms, allow them to do different positions or things like that. So it's not required, but certainly it can be beneficial for some people. Does gastric problem cause hair fall? I have no idea. I'm sorry. That's not my area of expertise. How to cure phimosis. So phimosis is when the foreskin gets stuck and is not able to be retracted backwards. And you can try sometimes a little bit of steroid cream to see if that helps. And if it doesn't, then the treatment is surgical or removal of the foreskin. If you ever pull back your foreskin and you want to make sure you pull it again over the head of the penis, otherwise you will get what's called a paraphimosis. And that can actually be a surgical emergency because it can actually get tight and stuck and then cause swelling beyond it and cause pain. And then that could be a surgical emergency. Thank you, those bears and apotheosis divine. Does the hydrocele go away in time on its own? A hydrocele is essentially a swelling of the scrotum that's due to a fluid-filled sac, essentially. And the causes are, multiple different causes, but it's a benign condition in that there's no concern for cancer or anything else, but it can be uncomfortable. In babies or children, if they're born with hydroceles, those do go away, but in adults, they typically stay. And if they're not bothering you, there's no reason to do anything about it. But if they are bothering you, the treatment is surgical. And so talk to your surgeon or urologist about that. Will a vasectomy negatively affect testosterone, muscle mass, sex drive, energy? And no, it won't. Vasectomies are not known to cause any of those issues with sex drive, fertility. I mean, fertility, absolutely, but sex drive, testosterone, anything like that. A vasectomy is just simply going to sever the connection, the vas, which takes the sperm in through the vas and into the bladder. And so that specific connection is severed so that your sperm can't make it into the penis, urethra, sorry. And that connection is severed, so you no longer are fertile. If you do get a vasectomy, you do need to still use some sort of protection until you get what's called a post-vasectomy semen analysis to make sure that that you're no longer making semen. And so before you actually go ahead and have unprotected sex, because you still could get pregnant for that first time until you're sure. Okay. All right. I'm going to take a couple more questions and then I'll be signing off. So just to thank you guys again for joining me. Could you explain the sacral simulator? So I have a whole video on this it's called the bladder pacemaker video. So if you go to my overactive bladder playlist, again, I'll link it in the description after I'm done here. But the sacral nerve stimulator is a surgery that is a procedure that's done for 3 indications: overactive bladder, which is urgency, frequency, going to the bathroom more often than usual, and gotta go, kind of can't delay. And then nocturia, waking up at night to urinate, and sometimes leakage that is associated with that. It's also for fecal incontinence, so having accidents with stool. And lastly, it's for non-obstructive urinary retention. So people who can't pee because maybe their bladder's not squeezing well, this is an option for them. And you can watch that video to go over exactly how the procedure is done and what to expect. Thank you guys for I'm going to answer these last two answers. Apotheosis divine, what are the average size balls? So average size is like about this big. And there's if you just Google it, you could find the exact amount. I can't remember off the top of my head, but again, the size is not necessarily super important unless it's very, very small, in which case it could be causing some infertility if you are having trouble having a baby and trying to have a baby. My ultrasound said that so I can't give you specific medical advice online because you're not my patient, but I'll give you general advice. 1.4 centimeter hyperechoic structure adjacent to the left epididymal tail sounds like a cyst. That was probably benign. The large majority of epididymal cysts. So if you have something that's on your epididymis, which is it's a structure that goes alongside the testicle, that is very often benign. The chance of cancer in those sorts of things is about 2%, and usually those do regress in size. Is probably so I wouldn't worry too much about that. All right, last question, guys. I talked about phimosis already, so please, you can rewind back on that. Causes of treatment of low libido in men. So if you're having low libido, you want to get evaluated for a hormonal problem. And so you want to get your total testosterone checked early in the morning before 10 a.m. because that's where the reference values come in. You want to then get also a couple other lab values like a prolactin, estradiol, and LH to make sure there's no hormonal problems that are affecting testosterone production. And then usually, very commonly, you will find something abnormal and you can then treat that low testosterone depending on your age and your desires for fertility. There are options available for treating testosterone with either just testosterone replacement or other medical options as well. All right, guys. Thank you so, so much for joining me. And as always, remember to take care of yourself because you're worth it.